Greetings, Green Warrior, and welcome back, Dr. Rogers.
Hi.
Well, Green Warriors, up because Dr. Rogers is going to break down the science of sleep and share practical strategies to improve your rest naturally. It's just so mysterious, and for some people, sleep can be so elusive. And we keep hearing conflicting information. And of course, a lot of people are tempted to or do rely upon over-the-counter or even prescription medications. And meanwhile, our body is just meant to do this naturally, and we just have to figure this out. And Dr. Rogers is here to help us do that. Green Warrior, I would like to know if you struggle with sleep. Tell us in the chat if it's something that you find either that you have struggle falling asleep or staying asleep. Tell us in the chat, because I would like to know about that. And I think what we're going to do, Dr. Rogers, it does have a wonderful presentation ready for you. But before we do that, we're going to start with our game of true or false.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, now, of course, Dr. Rogers will be talking in detail about these answers, but we're just going to briefly go over it. Green Warrior, here's the first one. True or false? Poor sleep can increase the risk of chronic disease. Okay. And Dr. Rogers, while they type in their answer, what do you say?
Yeah, when you have poor sleep, you elevate the same hormones as psychological stress, which means increased cortisol and increased catecholamines. Well, the cortisol is going to bump up your blood sugar. It causes insulin resistance. So lack of sleep increases your risk of diabetes. It also increases blood lipids. So it increases your risk of atherosclerosis. And, you don't want that. It increases your risk of hypertension. The catecholamines means adrenaline and noradrenaline. They increase your blood pressure. They speed up your heart rate. So that right there is some pretty significant consequences of lack of sleep. Plus, when you're sleep deprived, again, it's like being stressed out. You become more impulsive. You say and do things you wish you hadn't said and done. So it's a good idea to try to get adequate sleep. Your body heals during sleep. You consolidate your memories during sleep. And I'm going to talk about some other things really important. Basically, your brain cleans itself while you're asleep. So that's pretty important.
Wow. There's so much that goes on in our bodies, and we think of detoxing, if we fast and things like that. But sleep most definitely is another way of cleansing our body. So let's go with the next one. And of course, you're going to get into more detail about all of these in your presentation. Green Warrior, true or false? Caffeine has no effect on sleep if consumed in the morning. Okay, what do you think, Green Warriors? Dr. Rogers?
Yeah, I think caffeine is for chumps. Don't get me wrong. I used to drink, 1 or 2 cups a day for about 20 years. But I finally learned, the more I started to study it, the worse it looks. Basically, caffeine is a hormone of the acute stress response. So it does a lot of things like we just talked about from sleep deprivation, things you don't want. It increases cortisol and it increases catecholamine. So it's a bit of a brain stimulant. What that means as a brain stimulant is it increases glutamate, the excitatory neurotransmitter, going from one neuron to another, ramping up the metabolic rate of those neurons. That has a tendency to cause insomnia. The half-life is about 6 to 8 hours. So even if you drink it in the morning, some of it is on board at night. You might still sleep the same 6 or 7 hours, but you won't sleep as deeply. I also noticed when I quit caffeine, I just tapered it off 25% each day to get rid of each cup over the course of 4 days. That I felt a little sad for about 3 days. Then I had intense cravings for about 2 weeks. And then after that, I was quite glad I was done with it. I didn't get that afternoon lag and energy. My morning pep was back to normal in about 2 weeks. And I had been on 2 cups a day for many years, but then I did the same thing to get rid of the second cup. So yeah, I'm very glad to have gotten rid of it because it used to interrupt my day. I'd have a patient on the table waiting for a procedure, and I'd want to run and go get my coffee before I would start the procedure. I didn't want to get that withdrawal headache because it vasoconstricts the blood flow to the frontal lobes of the brain. in the ballpark of about 20%. The brain has compensatory mechanisms, but still, it actually makes you dumber. People think caffeine makes you smarter. No, it doesn't. It makes you more alert, more awake. If you didn't sleep the night before and you got to make a long drive, it would make sense to have a cup of coffee. But if you want to do the highest level academic work, it's not making you smarter. It does energize you a bit, but it's a bad habit. It's not good for your health. So something that makes you hyperlipidemic, tachycardia, insulin resistant, immunosuppressed a bit, all that stuff, the acute stress response. You don't want that going on every day for prolonged amounts of time.
Yeah, that makes sense. I used to drink coffee as well, and I feel so much better now that I don't. But tapering off is important, especially if people have a habit of doing more than 2 cups a day, even that, and it could maybe take them a little longer because, like you said, you do go through that detox. All right, let's go with our next question. True or false? You can make up for lost sleep by sleeping longer on weekends. That sounds like something maybe somebody would have thought about, at least in their younger days. What do you think, Dr. Rogers?
Well, you do what you can. When you got the weekend, you got more time to sleep. I do think it's good to sleep, but you don't quite catch up for everything you missed during the week if you're undersleeping day after day after day. And usually we wake up at the same time every day, so it's a good idea to just try to rearrange your night routine so you can get to bed earlier. I know that's difficult to do, but it's worth doing if you're not getting enough sleep.
Yeah. All right. And our final question, and then we'll be moving on to the presentation. True or false? Lack of sleep can contribute to weight gain and cravings. What do you say about that, Dr. Rogers?
Yeah, you will get craving because it's like sleep deprivation. You get a cravings for sweets because what's the purpose of cortisol and catecholamines? To raise your blood sugar. Okay, so these things over time, with chronic stress too, when it's chronically elevated, you're going to have more of a craving for sweets and junk food. Like, you probably eat that when you're stressed out. When you're super stressed out, you're in fear, fear of your life, and you don't want to eat anything. You crap your pants, okay, so to speak. But when you're just moderately stressed out from the caffeine and from the other things in your life, like sleep deprivation, the tendency to crave sweets. And I've seen a lot of people become unhealthy in that way. Workaholic types who are drinking a lot of coffee, trying to push themselves more work hours and not sleeping enough. And they often end up quite fat and sick. That was common in doctors. I knew this real famous trauma surgeon, and he was a real smart guy. He was a really good doctor, but he didn't let himself sleep, and he ended up real fat, and then he got a lymphoma, and he died of lymphoma. So he wasn't that healthy. So it's paradoxical, but a lot of even big shot doctors are fat and sick.
Yeah. And I think that a lot of people who get cravings at night, aside from maybe they are pre-diabetic or diabetic, I think that is just being tired, that can be a lot of the reason. And that's something to consider when you're trying to fight those cravings. All right. Well, good job, Green Warriors. And now we're going to move on to Dr. Rogers' presentation. Are you ready, Dr. Rogers?
Yep.
All right. We're going to add that on now.
Okay, so here's the first slide. Can you see it?
Yes, we can.
Okay, so here's a picture of the esophagus connecting to the stomach, connecting to the duodenum. And you can see that the stomach drains to the right. So this is a patient who is facing us. This is like the lower margin of the ribs. Okay, so the point of this is the stomach drains towards your right. It always does that. It does that in everybody. So what you want to do when you first go to bed is to lay with your right side down. Because a lot of us eat at night, for dinner or whatever. And so you want to lay with your right side down when you first lay down, because that way your stomach empties out. If you were to flip this over and have the left side down, you'll have increased tendency for gastroesophageal reflux, which you don't want. So whenever I lay down, I always lay right-sided down. That's the best position to sleep. Right lateral decubitus, meaning laying with your right side down. Here's another reason why right side down is best. Here's a chest x-ray. And you can see this is the left ventricular tip, left ventricular apex. Notice that the left ventricle apex of your heart is closer to your ribs than the right side of your heart is over here. So the point of the matter is, for a lot of people, they can feel their heart beating against their ribs when they lay on their left side down, especially if they're stressed out and their heart's beating fast and beating more forcefully. More forceful, it's contraction. So there's another reason why it's just easier to lay right side down, so you don't feel your heart beating against your chest wall. Okay, now there's a third reason. This one's less important and it's more variable. This is the venous drainage pattern of the brain. It's a common normal variant to have the right transverse sinus, sigmoid sinus be larger than the left, but it's variable. Not everybody has this. And it might be a little bit better for the brain at first to lay with the right side down. You can imagine this as a patient having their feet facing towards you, okay? So that one's not as big of a deal. And the reason is the brain is good. It has a lot of ways to drain itself. There's multiple venous patterns of drainage. There's drainage out by the orbits, drainage by the sinuses. There's veins that go through the bone, diploic veins and stuff. So, but I just mentioned it to you that I see a lot of those. Okay, I'm going to just say one or two things real quick about the brain. This is a side view of the brain called the sagittal view. And I'm going to mention to you something called the three-part brain of MacLean. MacLean was a Harvard neuroanatomist, and he described the brain as having, here's the brainstem, here's the pons, here's the pons, look like the belly of the pons, here's the midbrain, here's the medulla, and it connects to the spinal cord. And so he would describe that, he called that the reptile brain. This is sort of like an evolutionary biology perspective. The reptile brain of communicating, if you will, between the brainstem and the spinal cord. A reptile is simple, primitive, and that's what that does. Maintains your heartbeat, maintains your blood pressure, keeps you breathing, basic functions of animal life. And then built on top of that, the next step up is shaped like the letter C in a Chicago Bears football helmet. That would be the cingulate gyrus, which wraps around through the isthmus into the medial temporal lobe. That has been called the reptile brain, also the emotional brain. For example, a mammal brain. The reptile brain down here, just, a reptile lays an egg and it walks away. It doesn't have to do anything. It's easy to be a reptile parent. As a mammal parent, you have nurse live born young. You have to take care of them for a while. They're born helpless. Okay, so again, it's shaped like a Chicago Bears C helmet, and it's very impulsive. All right, and then on top of that is a cerebral cortex. Cortex means bark, like the bark of the tree. And on the outer part of the brain here, you've got the cortical brain where the gray matter cell bodies are. It's like a ribbon called the cortical ribbon. Cortex means bark like the bark of the tree in the periphery. That's where all the cell bodies are. Anyways, for this part of the brain does our sophisticated thinking, the things that are most unique and human about us. The more anterior you go, the more human and personal and unique your brain function is. Okay, so what am I saying here? The three-part brain of MacLean. How can this be useful to a person? Well, when you're sleep deprived, you're in more of a limbic mode, the mammal mode, okay, impulsive mode, and you're more likely to say or do something stupid. So if you find yourself in a delicate social situation and you feel like you're stressed out and you're tired and you didn't sleep enough, usually it's good to just keep your mouth shut and just wait till another day before you spout off, or at least be aware of how you're feeling so you don't impulsively spout off and say or do something you're going to regret later. And let's say you're talking to your boyfriend, girlfriend, husband, wife. You'll be more thoughtful. What are the long-term consequences of this? Your cerebral cortex is more capable of thinking about the long-term consequences of something. Okay, so that's what I would call the vertical functional anatomy of the brain. It's worth knowing. We won't talk too much about the brain, but you want your brain to be under optimal conditions, and sleep makes you smarter. The brain cleans itself at night through what is called the glymphatic system. Glymphatic is sort of a combination word of the glyph part is for glial. Those are the supporting cells of the brain. They're connected to a lymphatic system on the outer surface of the brain. And the glial cells, like the astrocytes, are like the mama cells for the neurons. They feed the neurons, they clean up after them, that sort of thing. Cerebral spinal fluid rinses over the neurons at night. When you're asleep, the brain can go offline. The brain cannot go offline while you are awake because, what is the purpose of a brain? The purpose of a brain is to walk through a path in a forest or a jungle or a prairie and to survive. It has to be alert. It has to be functioning correctly. Neurons are like little electrical circuits, and they have to have a precise microenvironment so they can conduct their electrical impulses. So the brain cannot go offline while you are awake. And so it cannot clean itself. In order to maintain those precise electrochemical gradients, it can't be pumping all its waste products into the extracellular matrix and disrupting its pH gradients. It can't do that. Okay, so that's why the brain cleans itself at night, because it can go offline while you're asleep. And it's kind of like Victorian English people dumping out their chamber pots from the floor above onto the street, and then the water comes and it rinses it away. And I'll show you some pictures of that. And you can also think about it, it makes sense. When does an animal need to be smart? After a big dinner, an animal doesn't need to be smart. It can go to sleep. In the morning, after it wakes up after a fast, it needs to be smart so it can go find some food. And how that relates to humans is the smartest you're ever going to get is right when you wake up out of bed in the morning. So if you're serious about doing academic work for that day, you want to sit in your desk and get going. Okay, here's a picture of the brain in coronal section. So the feet are always towards you. So this is the right side. This is the left side. This right here is a hippocampus. Okay, and that is the most important part of your brain for, forming memories, new memories. This is what I meant by the gray matter cortical ribbon. Cortex meaning bark, like bark of a tree. So these would be the frontal lobes in front, parietal lobes in back, temporal lobes down here. These deep gray matter nuclei are the basal ganglia. But anyways, this is the guy you want to protect, your hippocampus. That's key to your memory. If you damage that, you lose your memory, you become demented. Okay, and the hippocampus, by the way, is real sensitive to hypoglycemia. You don't want to mess with it. On the outer surface of the brain, you have lymphatics. These are in the meninges, the coverings of the brain. And then you have the dural sinus draining the brain. This is the superior sagittal sinus. And the arachnoid villi help absorb cerebral spinal fluid into the venous system. So your waste products of your brain, some of them are taken out of the brain, out of the skull through the lymphatics. Some of them are taken out via the arachnoid villi granulations and taken into the venous system. Okay. Dura mater just means hard mother. It's the name for the outer covering of the brain, the outer meningeal layer. Okay. All right, so here's a side view of the glymphatic system. And well, first of all, the cerebral spinal fluid system. The blue is for the veins. The little yellow interdigitations into the venous system. Those are the arachnoid granulations where they suck up the waste products and throw them into the venous system. Okay. The cerebral spinal fluid here is drawn in yellow, and it surrounds the brain, and it also surrounds the brainstem and the spinal cord. And it's sort of like a shock absorber for like a football helmet, a water helmet it would be like. So it protects from trauma. It also maintains electrolyte status in the brain, delivers some nutrients to the brain, does some cleanup, especially at night. Choroid plexus is where the cerebral spinal fluid is made. But the important thing to get out of all this is your brain cleans itself at night. You need to sleep so your brain can clean itself and function optimally the next day. Notice how as the day goes by, you get a little bit more absent-minded, a little bit stupider. If you do challenging academic work, you will notice you can do your best work when you first wake up in the morning, and you're just not quite as good the rest of the day. Okay, I know some teenagers think they study best at night, and teenagers tend to be a little bit circadian rhythm shifted towards later. Okay, they tend to want to sleep later in the morning, for example. I can remember when I was a freshman in college and a sophomore in college, and some class I wanted to take was only offered at 8 a.m., and I thought to myself, this university is insane. Why would anybody want to go to a class at 8 o'clock in the morning? That is far too early. Whereas nowadays, that would be fine. 7 o'clock would be fine. Okay, anyways, glymphatic system. This lady right here, Macon Nettergaard, she did a lot of the great research on the glymphatic system, figuring it out. So here's a more detailed drawing of it. Here's the artery traveling first on the convexity of the brain, then entering the brain parenchyma. So it's a penetrating artery. Penetrating arteries into the brain parenchyma have a sheath around them called the perivascular space. It's actually specifically called the perivascular space of Virchow-Robin. Okay, those are famous anatomist pathologists. The point of it is at night, this perivascular space opens up wider, and the cerebral spinal fluid that's drawn in yellow in this picture flows in around the penetrating artery, and then it will then pass out the side of it, and it'll be directed towards the associated vein, corresponding vein. These are neurons here, these purple cells, and they're pumping out these waste products here, these sort of brown patches, and the cerebral spinal fluid rinsing through the brain parenchyma is washing it into the venous system. So this is how the brain cleans itself at night, okay? That is the glymphatic system. All right, and I just drew a simplified drawing, in my own drawing of it, that here is the cerebral spinal fluid entering the brain parenchyma in the perivascular space. And then here's the astrocytes, the support cells, and the foot processes. And they got a lot of aquaporins on them. They're going to let this fluid pass into the brain parenchyma, rinse over the neurons, and then send the waste products into the venous system. Also some in just the CSF to be rinsed out through the arachnoid granulations, And this is how the brain cleans itself. Some of it will go into the lymphatics. What else to know about it? Well, that's the main point. It only runs at night. Okay. Oh, people who don't sleep well, they end up with a lot more accumulation of toxic beta amyloid protein and other problems. You don't want that. That'll increase your risk of dementia, chronic lack of sleep. Here's a diagram of what sleep is like. This is called a hypnogram. Okay. So what happens here is when you first go to sleep, it takes a little while before you fall asleep. That's called sleep onset latency, how long it takes before you fall asleep. All right. Then you pass downward into sleep stages 1 and stage 2. And that's sort of light sleep, okay? Then you pass into deep sleep. Deep sleep is called deep sleep because your body is paralyzed. Your body's paralyzed during that time. The neurons go offline and your brain's cleaning itself. Then you go through cycles of it. The reason why these cycles don't last longer is because when your body's paralyzed, you're laying in one position. You don't want to lay in one position for more than, an hour or so. Because if you just lay in the same position, let's say for, all 8 hours in a row, you could develop a bed sore, a decubitus ulcer. You could develop rhabdomyolysis of the muscle and be compressed with no blood supply. Okay, so anyways, you go into a phase of deep, deep, deep sleep. They also call REM deep sleep just because you're paralyzed during that time. The reason you're paralyzed during REM sleep is because you're dreaming, okay? And while you're dreaming, who knows what you're thinking of? And they don't want you making uncontrolled movements and hurting yourself or hurting the person in your bed if there's somebody in your bed with you. So that's why the body's paralyzed during a dream. If you wake up and you're thinking of a dream, you wake in the middle of a dream, then you were in REM sleep, okay? But the key point here is you want to spend as much time as you can in slow wave sleep. So the deepest sleep here is called slow wave sleep, delta power sleep. It's important for consolidating your memories. You get a little bit of a growth hormone in a healthy way. As people get older, especially in the elderly, they tend to have less of this stage 3 slow wave sleep. Let's see what else. And then you'll kind of drift through these cycles and you'll come back up. When you're in sleep, when you're in the lighter phases of sleep, like 1 and 2, you don't sleep as deeply. It's not as therapeutic for your brain. And you're going to come up to REM and you're more prone to being awakened, okay? As men get older, they tend to have more of a problem with the prostate getting a little bit enlarged, especially if they ate the standard American diet, and they'll have to wake up the void. Okay, so I'm going to talk about that. Like one of the things I noticed is when I was younger, I would like the room to be a little bit cool at night when I sleep. And the logic of that was, well, gee, in nature, it gets cooler at night. It's natural to be a little cooler at night when you sleep. What I found out now that I'm older, I'm 61 years of age, by the way, is that I actually like it to be kind of hot at night when I sleep. The reason I say that is the way I'm figuring is if I sweat out some fluid, then I'm not going to fill my bladder as soon and have to wake up the void. So I think I sleep a little bit better. And I sleep quite well. I'll explain some of the things that I'm doing that I believe are helpful to that. So then you go back and forth through these cycles. So you want to have everything optimized as best you can, because when people get older, they tend to have less sleep in the slow wave sleep, the deep phase of sleep. So by having good habits, you'll get more of this deep sleep, and it's good for you. It'll keep you smarter, keep you healthier. When you first lay down, that's when you tend to get your big slow wave sleep episodes, more prolonged time down there. As you move towards morning, you start having more dreaming, more REM sleep. And REM is also good for your brain, but most important thing is try to get your deep sleep. Okay, here's some general sleep hygiene pieces of advice. Most of us wake up at about the same time every day, especially if we're working with a job with a fixed schedule. So you want to try to get in the habit of going to bed earlier to get more sleep if you're not getting enough. That tends to be the main thing. Usually most people need somewhere between 6 to 8 hours a night. You'll know from experience what tends to be the amount that you need. On a non-work day, if you can sleep in, good for you. Get your sleep. I don't put my alarm clock on non-work days. Avoid bright blue light at night. Our melatonin system is somewhat programmed by bright blue light, like middle of the day in the sky. So you don't want to look at too much of that at night. If you can, try to avoid your computer a little bit, your cell phone a little bit at night. The screens tend to give off a lot of blue light. The reason why they keep the bright lights on in the Vegas casinos is they want to keep you awake gambling while they know your brain's not at its best. You want to avoid computers and cell phones at night to the extent you can. If you have an alarm clock, get one with a red light. That's less annoying. That's why you go to the zoo, you see the nocturnal animals, they got a red light around them. Avoid unnecessary stressful stuff. Like, don't watch, stupid news or other TV at night if it's going to just stress you out, make you unhappy. Figure out how you want to manage your stress. Things like having a strong sense of purpose in your life. All the major religions, they also reduce stress. People in all the major religions are a lot healthier. Get your exercise. If you exercise during the day, you build up something called sleep drive. And what I mean by sleep drive is your body wants to sleep. So when you put your head on the pillow, you go to sleep faster and you go into deep sleep for a more prolonged time. It's more refreshing. So that's one of the nice benefits of exercising as well. I already talked about how sleep deprivation is like having more stress, and it increases your risk of diabetes because it causes insulin resistance. Be careful with drugs. There's some drugs, besides caffeine, there's some drugs that will make you more prone to not sleep well. So if you're having trouble sleeping, look at if you're on any pills, go through the side effects yourself or ask your healthcare provider to do it. See if insomnia is a common side effect for that drug. It takes time for melatonin to ramp up. So again, start winding your day down a couple hours before you go to bed if possible. Good to put low watt bulbs in your bathroom if you have to go in there at night. Consider using halogen lights if you can. They're better than the LED lights. They have less of an effect on you for sleep. I don't like fluorescent lights. Try to avoid those as best you can. I like the room to be as dark as possible, but just enough light in the room at night that you can sort of see where you're going. You can get a hint of it, and arrange your furniture to make sure it's not going to block your path to the bathroom at night. Let's see. I talked about minimize alcohol intake. We talked about minimizing caffeine. I'd also watch out for all these processed foods. They're full of chemicals that you don't want. They're full of manufactured free glutamate. The glutamate stuff, it's a mild stimulant. It's pretty mild, but it can cause insomnia in some people. Avoid preservatives that are potentially associated with hyperactivity. So don't eat any processed food. There's all kinds of stuff in processed food that you don't want. These things like calcium propionate, sodium benzoate, sorbates, food dyes, some of those can be associated with hyperactivity, attention deficit in kids, insomnia. The bedroom should only be for sleeping and for making the two-back beast. Should get all the electronics out of the bedroom other than your alarm clock. EX helps a man to sleep. Men who have SEX twice a week, they have lower risk of heart attack. And I used to notice my old friends, I have some geriatric doctor friends of mine, and they tell me the old guys that are asking for a Viagra said they all live a lot longer than the guys who've, given up on chasing women. I told my wife that if she doesn't, make the two-back beast with me, I might die. She didn't seem to care. She wasn't concerned in the least. I couldn't believe that. So insensitive. Why is sleep so important? I told you because it cleans your brain. I went through all that. Okay. You can't go offline in the daytime. You need precise ionic milieu. Things that make sleep worse. We talked about this. Also, cigarettes, of course, being sedentary in the daytime, lack of sunshine, ever seen the sun, which many of us don't. We go to work early and then we work all day inside and we don't see any sunshine. But getting some sun at midday also helps to set your circadian rhythms. Now, there's been a bunch of papers on tart cherry juice improving sleep. I don't know for sure if that's true. I did eat a whole bunch of cherries one day and I slept better that day. But I can also tell you, I talk about exercise and day improve sleep. I don't know if these papers are indirectly paid for by industry. They might be, because I've also guzzled down 32-ounce things of tart cherry juice, and it didn't seem to affect my sleep much. They process stuff more when it's already made into a juice. I don't know if they're putting preservatives into it. But for what it's worth, that's one of the things talked about. Processed foods, we talked about how they make them. They seek what's called a bliss point. And they'll put, the right amount of MSG. MSG just means manufactured free glutamate. It's the glutamate that gets the taste effect. Right amount of sodium, mouthfeel, and texture materials. The right amount of fat, high fructose corn syrup. All the stuff in processed food is to get you addicted to the food. But this can be a stimulant effect, MSG, MFG, okay? The salt, of course, can increase hypertension. It's a vasoconstrictor. You don't want that. The fat drops blood supply to your brain a little bit. Here's just taking a protein, and this could be anything, any protein. Milk protein, casein, soy protein, whey protein, gluten proteins, they all have a real high percentage of glutamates in their amino acid composition of their proteins. So any type of processing, to ferment it, to fat separate it, to extract it, to hydrolysis, ultrapasteurization, all these things break it up into individual amino acids, and you free up the individual glutamate. So that's what manufacturer-free glutamate means. And that can sort of overwhelm the intestinal lining's ability to sequester it, so you get more of it in the blood. Because normally the body doesn't want that floating around free in the blood, because it's the number one excitatory neurotransmitter of the brain. 90% of the cerebral cortex neurons run on glutamate, and it's a stimulant, okay? Normal cell has about 1/3 of its energy goes to make this plasma pump for potassium and sodium, and it functions like an electrical battery in a cell. You need magnesium for any ATP reaction. We'll talk about that more in a moment. You're pumping more sodium out than potassium in. 3 positive charges, 3 sodiums, 2 positives coming in. So regular cell is going to have a gradient of about negative 65 millivolts across its plasma membrane. So again, like a battery, you've got storage of current on 2 sides with an obstruction to current flow. Then the current flows when you open up the channels in the form of these charged ions. And you can take this energy that builds up an electrochemical gradient. So it's electrical gradient in terms of negative 65 millivolts. You also have about a 10-to-1 higher concentration of sodium outside the cell than inside the cell because of this pump. And therefore, you have a chemical gradient. So this is an electrochemical gradient, and it functions like a battery, and the cell uses it for tons of things. This is the sodium calcium exchanger, and the electrochemical gradient of sodium is coupled to this to pump calcium out of the cell. That's real important because calcium coming up in the cell cytoplasm, that's what turns a cell on. That's what activates a cell. So calcium is a big deal. Here's a neuron, and here is the nucleus of the neuron where the DNA is located. This is the cell body part of the neuron. These are the dendrites for incoming information. Dendrite means like a tree. It looks like tree branches sticking out. So incoming information stimulates the cell body of the neuron. If it's an adequate stimulation, it will activate an action potential, which is begun at the axon hillock. It's transmitted down the axon. These are myelination, like insulation around a wire. They speed up electrical conduction, and it'll travel down to the axon terminal. And there's actually going to be, I'll show it on the next picture, there's going to be a voltage-gated calcium channel right here. So this is going to be transmitted by sodium. So here's the axon terminal. These are neurotransmitters in transmitter vesicles. These transmitter vesicles are going to travel to the synaptic cleft, merge with the plasma membrane, be released in the synaptic cleft. They'll diffuse across to the postsynaptic neuron, and they'll excite it. Okay, so here's the same picture with more details, showing that the action potential is run by sodium channels till it gets to the axon terminal, and then the voltage change from these having been opened up will activate the voltage-gated calcium channel. And electromotive force will also open this up, like Wi-Fi and cell phones. That's why you don't want to hold your cell phone right to your head. You want to hold it in front of you whenever possible and use speakerphone. Okay, well, anyways, when the calcium comes up in the cytoplasm, because it's entering in here at a rapid rate, these neurotransmitter vesicles will travel to the plasma membrane of the presynaptic neuron, and they will then, again, be released into the synaptic cleft. Okay, here it is in more detail that, let's say you get the calcium channel opening up, calcium goes up in the cytoplasm, now the glutamate neurotransmitters, they travel to the plasma membrane, they diffuse across the cleft, and then they stimulate the postsynaptic neuron. That's normal nerve transmission. Magnesium ions block the NMDA receptor for glutamate, but once the discharge of the neuron occurs, because they bind first to something called an AMPA receptor, and that raises the resting membrane potential of the postsynaptic neuron. Then once the positive charge is removed because of the sodium inflow through the AMPA channel, then the magnesium will pop out of the NMDA receptor. Okay, that's normal activation of neuron. And the reason I'm going through all this is it always starts out simple, but then it starts getting more and more complicated. If you have aspartame, the sweetener, you will then have increased activation of the NMDA receptor. If you have glycine, and glyphosate is an analog to glycine that's the herbicide sprayed on non-organic soy, both of those things will activate the NMDA receptor. If you eat a high-fat diet causing insulin resistance, the enzyme to remove insulin from the blood is called insulin-degrading enzyme, IDE. It has a higher affinity for insulin than it does for beta amyloid protein. But guess what? It's also what clears beta amyloid protein from the peripheral blood. So it gets used up. It can only be made in limited quantities, the insulin degrading enzyme. And when it's all used up, beta amyloid protein moves from the periphery of the body. Periphery of the body means outside the central nervous system, outside the brain and spine. And then it goes back across the blood-brain barrier into the brain parenchyma, and it activates the NMDA receptor. Okay, that's part of the reason why diabetic patients tend to be so stupid. There's so many things happening in diabetes to destroy your brain. It's not even funny. And so you see what I'm saying is people want one answer. There isn't one answer. The only one answer I can give you is learn how to be smart about your health. Eat a low-fat, low-sodium, vegan diet. That's what leads to health with no oil. There's actually some advantages to low protein, but I'm not going to go into all that today. But I just wanted you to get the idea of it. There's multiple little things that are working together to destroy your health and destroy your brain. And the smart thing to do is, in a sense, like I said, live kind of like Adam and Eve, but keep your indoor heating and plumbing, which means be kind of simple. Eat whole plant foods. That's what we're made for. And this is what I meant by EMF will open up voltage-gated calcium channels right here, and it'll activate that presynaptic neuron. Okay, in order to get that calcium out of the cytoplasm so you can shut that neuron off, you need ATP. ATP is adenosine triphosphate. That's the energy currency of a cell. And you'll then use the ATP energy to pump calcium out of the cell. You'll run this pump, and that lets you run your knockout exchanger, which is really fast for pumping calcium out of the cell. You can pump calcium into the endoplasmic reticulum. It's called SERCA just because in the muscle it's called sarcoplasm, but it's sarcoplasm, endoplasmic reticulum, calcium ATPase because it uses ATP to run. But the fact that you need ATP, you always need ATP to pump calcium out because you're always pumping against a big gradient. The extracellular matrix is 10,000 to 15,000 times higher in its calcium concentration than is the cell cytoplasm. So you have to use energy to pump against a gradient. And what does that mean? It means you need your mitochondria function because that's where your ATP is made. So if you have a mitochondria inhibitor, that's going to mess you up as well because you won't be able to make as much ATP. Magnesium is easy to get from eating plant foods because magnesium is right in the center of chlorophyll. Pretty much everything good comes from plant foods, okay? You get your magnesium, your potassium, your plant nitrates. Those are your vasodilators, keep your arteries open. You get your fiber. Your fiber is taken by the good bacteria in the gut, made into short-chain fatty acids, in particular butyrate. Butyrate maintains your gut lining cells at tight junctions. The remaining butyrate goes into the blood, travels to the brain, maintains the blood-brain barrier, okay? It protects you. Fiber is your friend. It also maintains the kidney barrier. Cortisol, the stress hormone, sleep deprivation hormone, caffeine hormone, increases glutamate in the hippocampus. It does a whole bunch of other things that you don't want. The purpose of cortisol is to maintain your blood glucose when you're starving, to also help you generate higher blood glucose and lipids when you're stressed out because you need that extra energy to fight or flight, to save your life for the next 30 minutes. But in a lot of modern people, it's chronically elevated because they're sleep deprived, they're stressed out, and they're drinking coffee. What is the effect of cortisol? Cortisol stimulates the presynaptic nerve to release more glutamate. And again, same thing happens from stress, from caffeine, and from sleep deprivation. So again, it starts overactivating these neurons. And you don't want to overactivate neurons because it can cause insomnia, it can cause anxiety, it can cause a paradoxical depression. And if you overstimulate them and you can't deliver adequate energy to them, they can even die, go into apoptosis. So here's one paper showing acute caffeine ingestion reduces insulin sensitivity. Because there's a lot of people on the internet saying, oh, coffee is good for you and tea is good for you and caffeine is good for you. And I'm like, yeah, right. My advice, don't listen to that nonsense. All you have to do is look at basic principles. Caffeine increases cortisol and catecholamines. You cannot get away from that. And if you're going to increase catecholamines and cortisol, you're going to predispose to obesity over time. You're going to cause high blood lipids, hyperlipidemia. You're going to cause high blood sugar, hyperglycemia. You're going to cause insulin resistance, okay? You can't get around that. And stress also causes increased loss of potassium in the urine, further leading to a more pro-sodium picture with more hypertension. You're going to have speeded up heart rate, tachycardia. You're going to have increased force of contraction of your heart. That's part of you having hypertension. So over time, it's more stress on your heart. So it's all bad. You don't want that. You're also going to lose more magnesium in your urine. Magnesium is M for mellow you out. So you're going to be a little more stressed. You're going to be more impulsive. It also causes vasoconstriction of the frontal lobes of your brain in the ballpark of like 20%. And there's compensatory mechanisms, but still, you're going to be in more of a mammal limbic mode, more likely to do things that are impulsive and stupid that you're going to regret later. Okay, I'm going to talk a little bit about EMF. All right, I just wanted to show you this concept. Here's a dance studio with a bunch of mirrors. Now imagine you took these mirrors and you turned them inside out, so they're facing outward, okay? Here's a mirror on top of the bed if you want to watch the show, but imagine you could flip that mirror upside down, okay? And here's what you call a Faraday cage around a bed. It's an electrical cage to minimize the amount of EMF. EMF means electromotive force on the people sleeping in the bed. You can take an EMF meter and buy one off the internet for probably about $50 or something. And you can then measure the EMF levels in all the different rooms of your house. Probably the most important one to have a low EMF is your bed, because you spend a lot of time sleeping in your bed, maybe in your office area as well. So I made one of these at my house, my former house. Okay, so these are mirrors on the outside of the bed. The bed's in the center of this thing. And these are mirrors facing outward from the wall, and then a mirror up on top, okay, and a mirror on the ground below. So what did that look like? So here's the bed. Here's the mirrors facing away. Here's the mirrors facing outward to the walls. And then I would close the Faraday cage at night. I would measure the EMF inside the bed. It's 0. Okay, that's good, 0. So you don't have to do this, but I thought it was nice to do. I measured the EMF in all the different rooms of the house, all the offices and stuff, and made sure anywhere that people spent a lot of time, it was very low. Those are some of the mirrors facing outward, some of the mirrors facing away from that bed. Okay, so, why do all this stuff? Because, like I said, there's multiple minor things that are harming your brain cells, your neurons, and it's good to control what you can control. I talked about the effect of excessive cortisol, so you minimize that by managing your stress, by having a sense of purpose in your life. People who've got a strong sense of purpose in their life, whatever it might be, it could be just to take care of your children. You could be a teacher. You could be a coach to help your students, to help your athletes. It could be, whatever you do to help other people. You could be, helping people with nutrition, okay? Whatever it is, you have a strong sense of purpose in your life, something that motivates you, you're excited to get out of bed in the morning. That gives you more resilience, okay? And that lowers your stress. Because when you say to yourself, well, I got a couple things in my life that are making me sort of frustrated, but the most important thing is that I help my students, help my athletes, or whatever, help my patients, then it gives you more resilience to endure. Sort of like the old, a lot of people have said this, Dostoevsky, Frankl, etc. A man with a why can endure anyhow. Okay, you just become more resilient, and you handle your stress better. Religious people handle stress better. Give it over to God, so to speak. All right, and then you avoid things that are stress equivalents like caffeine and sleep deprivation, because you don't want unnecessary stimulation of these neurons for no reason. You can't completely avoid EMF, but you avoid it to the extent you can, so you don't overstimulate the neuron for no reason. You avoid excessive high-fat diets, so you don't grind up all your insulin-degrading enzyme and you got none left over to remove your beta amyloid protein. Okay, you try to get adequate sleep, because also beta amyloid protein goes up if you don't sleep adequately. Eat only organic foods, so you're not eating this glyphosate stuff. Or only if you can't afford organic, eat foods that don't have glyphosate in it, because it's also an excitotoxin. It's a toxin to the gut. It also causes fatty liver, and it's an excitotoxin to the NMDA receptor, the brain as well. So it's best avoided. Never drink any. Don't use any of the sweeteners. They're all bad. Aspartame is a brain excitotoxin. Stevia is associated with infertility. Xylitol is prothrombotic. I think erythritol is also. They're all bad. Let's see what else on here. By eating your dietary fiber, you prevent leaky gut, and then simultaneously, because butyrate protects the blood-brain barrier, you prevent leaky blood-brain barrier. So you want to do that. By avoiding high-fat meals, you avoid hypoxia related to postprandial, hyperlipidemia and elevated LDL cholesterol. Of avoiding excess dietary sodium, it's a vasoconstrictor that also provides better blood flow to the brain. Avoiding caffeine, better blood flow to the brain. So you get more oxygen delivered to your neurons. Because, again, they have to be matched. You've heard my theory before, the Peter Rogers, MD, supply and demand theory of how you got to couple metabolic rate of neuron to oxygen and glucose delivery. And you also need mitochondrial function in there. It's really a 3-part concept. And if your mitochondria are inhibited, you're not going to function as well, because you got to make that ATP to pump calcium out of the cell cytoplasm. Mitochondria inhibitor is a perfect example of processed food. They put all these mold inhibitors in there because they don't want the food to get moldy and spoiled. Then they got to return it to the maker. So the maker of the processed food puts fungal inhibitors in there, mold inhibitors. But guess what? Lots of these mold inhibitors are mitochondrial inhibitors. Okay, quick word on pulmonology, the subspecialty of internal medicine. These are the guys that, run the ICUs. They do bronchoscopy of lung cancer. And, in the 1970s, America was a smoking country. Both of my parents smoked, but people started quitting around the 1980s. Both of my parents quit. In medical school, the word on the street in sort of the early 1990s that only a chump would go into pulmonology, because with everybody quitting smoking, they figured they're not going to have anything to do. They're going to starve to death. And there's sort of two main categories of doctors. There's the internal medicine doctors and their subspecialties, and then there is the surgery doctors and their subspecialties. So pulmonology belongs to medicine, and it's kind of equivalent to what ear, nose, and throat is to surgery. The ear, nose, and throat ENT doctors tend to be nerdy intellectuals. And as far as internal medicine goes, the pulmonologists are kind of the nerds of internal medicine. The guys walking around, engineers with a pocket protector and a slide rule. They're sitting there in the ICU, calculating, analyzing the blood gas, deciding whether to turn up the PEEP on the ventilator. So anyways, I sort of felt sorry for these pulmonologists when I was going through my early days in medicine. I thought these guys, a lot of them started switching to doing fellowships in ICU, intensive care unit medicine. And I thought, oh man, that's going to suck, working the night shift. And then they started doing fellowships in sleep in the 1990s, mid-1990s. And I thought to myself, that is so stupid. Why would somebody do an entire fellowship for a year or longer to learn about sleep? I could learn everything I wanted to learn about sleep in a weekend of just reading. But I was wrong, because there's a new sort of tidal wave of patients coming in, all these fat people with sleep apnea. And fat people are big money, big business. They kind of have Pickwick syndrome, meaning they get short of breath real easy with not much physical exertion, but tons of them have sleep apnea. And they nowadays are sending all these sleep apnea. I never even heard of sleep apnea in medical school. It was a rare thing when I was young, but now it's super common. There's tons and tons of fat people. So instead of taking care of the COPDers, chronic obstructive pulmonary disease patients, the blue bloaters and the pink puffers, they've now got the fat snoring people. Here's a CPAP mask, and continuous positive airway pressure that they'll put on the sleep apnea patients at night to help them keep their airway open. They tend to obstruct at the level of the back of their tongue. I think some of it's due to neuropathy as well. I think the obstruction component's overrated, because one of the things that I am also is I'm a neuroradiologist, and I see many tens of thousands of airways, and I don't see that much. They say, oh, well, men accumulate fat in the back of their tongue. I'm like, yeah, BS. I don't see that much fat in the back of tongues. I look at them every day. So be that as it may, they'll put these patients in sleep studies, and I sometimes looked at the results on these things, and I see guys, they're dropping their oxygen saturations into the 60s. That's pretty low. Now, don't get me wrong. Most people don't have sleep apnea that bad, but you can see the potential disaster here. If you're dropping your oxygen sats into the 60s, what happens is you get this hypoxia, and the stress of the hypoxia wakes the patient up. So they have frequent episodes of waking up at night. They snore really loud, and so they annoy their partner in bed. And, they're very often diabetic. So being fat and diabetic, probably hypertensive, and having sleep apnea, every one of those things can damage the brain. And a lot of these guys have a real high hemoglobin A1C, very poorly controlled diabetes. And, you've heard the expression highway to hell. They're on the highway to dementia, okay? I've seen plenty of people demented in their 40s. I know that's uncommon, but I can tell you it is routine that people are cognitively slow in their 50s and especially in their 60s. I got internal medicine doctor friends of mine, and it matches my experience with procedure patients. Most patients are fat, sick, and stupid, cognitively slow by the time they're 60. It's sad, but it's true. And some people say, oh, well, why do you say that? And I'm just telling you, the kind of people that are watching this video, they're not your typical hospital patient. These are smart, motivated people that want to learn about their health. The average patient is kind of functionally illiterate. They don't know anything what's going on. And people that don't know anything about health, they get sick all the time. So that's why every doctor is quite familiar with talking to alcoholics, drug addicts, people that have real poor functional levels because they're sick all the time. All right. So we talked about obstructive sleep apnea. Let's see. Anything else interesting here? They often have excessive daytime sleepiness. And if you had to ask me, who are the stupidest patients that I see on a routine basis? Number one would be kidney failure patients. Kidney failure does a lot of bad things to the brain. And they calcify all their arteries. You see all their arteries are all calcified, and they have poor perfusion of their brain. Number one is that. Number two would be diabetics, just because diabetes is so common. It's like the vast majority of the patients over 55, they're all pre-diabetic or diabetic. And then the other thing would be sleep apnea patients. They're often falling asleep on you, and they're real cognitively slow. So if you've got sleep apnea, man, you want to do everything you can to fix it. You want to lose weight as fast as you can. Eat a low-fat, starch-based diet. There's a big movement going around, all this promotion of fat foods. I'm just going to let you know flat out, I don't believe in it at all. Okay, Nathan Pritikin was a genius, and that guy reviewed all the literature on fat back in the 1970s, and he came to the conclusion, fat is bad. We're not designed to eat. We're designed to eat as low fat as we can. He even quoted a bunch of studies where people ate less than 1% of their calories from fat, and they did quite well. Okay, Dr. John McDougall, he said, the biggest toxin in the Western diet is the excessive amount of fat. And I've studied a lot about fat. They're all bad. Okay, spare me with this omega-3 stuff, all right? Omega-3s increase the risk of atrial fibrillation. They increase the risk of obesity, of weight gain, of atrial fibrillation. They cause immunosuppression. They increase the risk of prostate cancer. And now I haven't seen the paper saying they increase the risk of breast cancer, but I'll bet you they do, because most things that increase the risk of prostate cancer increase the risk of breast cancer. And they immunosuppress you. In animal studies to get more metastatic disease. Why would you want that? Okay, omega-6s are a disaster. Sat fat is a disaster. So you wouldn't want it. You get just enough omega-3s coming packaged as C18 linolenic acids and low-fat plant food. That's all you need. You really don't need much. Same thing with omega-6s in that fashion. Avoid things that smell bad, okay? I used to be, and I still am, I'm pretty sensitive about smells. I won't go near something if it smells bad. And I've always gotten made fun of, and I've always just said, well, look, okay, I'm just smart enough to pay attention to my body. So if you smell some paint or some glue or dry cleaning chemicals or anything and they smell bad, stay away from them. Like I won't let any of my clothes be dry cleaned anymore because those chemicals are toxic. Like trichloroethylene increases your risk of Parkinson's disease and dementia. I spent a long time. I run a neuroimaging conference where I teach all the other doctors. Plus, they come to me all the time. I'm known as being a pretty smart brain doctor. So I get lots of consultation about weird cases. And I'm telling you, anything that smells bad is probably bad for your brain. And like you don't want to be spraying stuff on yourself. Don't be spraying anything on yourself. Like these deodorants, they contain aluminum. The worst thing is to spray aluminum deodorant on yourself because you inhale some of it. It goes right to your olfactory nerve, your sense of smell, cranial nerve 1, and that goes right back past your limbic system near your hippocampus, and you're just dumping aluminum into your brain, a major neurotoxin. Stupid. Okay, let's see what else. Oh, sometimes if your house is noisy at night, like your family, you can just put the furnace on. Like I said, that creates a noise if you sleep near it, and that can distract you away from them. Let's see. Okay, makes you fat. Oh, if you got glaucoma. Oh, there was somebody talking about elevating the head of the bed if you've got glaucoma. It lowers intraocular pressure. There's some talk about elevating the head of the bed a little bit, like you can put it up on diagonal little blocks underneath it to elevate the head of the bed, to lower your risk of gastroesophageal reflux disease, and a few other things maybe. I don't know. I don't really like that idea, but if you're real sick, maybe that'll help you. I can also tell you there's a guy by the name of Dr. Roger Seaholt, and he is board certified in pulmonary medicine and board certified in sleep medicine. He has a YouTube channel called MedCram. And I think he's good on sleep. He's a smart guy, and he knows a lot about sleep. So if you're interested in some of the weird nuance issues in sleep, he's the kind of guy who would know those weird questions. For example, he'll know the drugs used to treat sleep. Me personally, would never take a drug for sleep. But somebody who's got a really bad refractory problem, maybe they might need that. All I'm telling you is he's a good reference on sleep. Fellowship trained, he's a smart guy. I've been impressed by what I've seen of him. I get the impression he's trying to help people. He's not a BS artist. Okay. You never want a baby in an elevated head of the bed situation because that's increased risk the baby will die. But just letting you know, okay, that's all I got for slides. This is just stuff on CERCA inhibitors, anything that smells bad. So I will end the show there. Hope that was helpful.
Yes, that was wonderful. Thank you so much. So much information to take in. And if Green Warrior, if you're like me, you'll probably watch it again just so that you can absorb some more of that great information. We did have some comments and some questions. So let's see what we have. Oh, when you were talking about bulbs, Ron said we use 40-watt bulbs. So that's, I guess, at night when you have lack of light. Yeah, it's amazing. Even when your eyes are closed, you can detect light if it's on. So that's definitely something that it's a good thing to consider. And Ron said, I'm curious as to why, when I was in high school, we were not given.
I'll tell you the why, because nobody cares about you. People think, you think the public school cares about you? No. The world's run by really, really, really rich people, and they don't want competition for their children. Public schools, and even to some extent, I went partly to public schools, and I also went partly to Catholic schools. And both of them were equally bad in terms of their education, but the Catholic school was at least better for social things and for behavior. But if you look at the public school curriculum, it's basically a joke. I've had this conversation with a lot of people. I ask them, what did you learn that you can still remember in grade school and high school? And usually what they say is, first they go, nothing. I go, well, you remember driver's ed? Yeah, you remember driver's ed. You remember the social part, learning how to talk to your friends and talk to girls, okay, the other sex. All right, but other than that, they usually can't remember anything. They go, oh, typing. I still remember how to type, right, because we use typing, we use driving. But almost everything else, you have forgotten it. And I'm actually going to say something that'll shock people, but I think that mathematics makes people stupid. And you say, well, how could you say that? It's so difficult to do math. And I'll say it because, almost nobody uses math. It's maybe 1 out of 1,000 persons. I'm a high-tech doctor, the highest tech you could be. I never use math. Nothing that I didn't learn after 3rd grade. They waste all your time with this mathematics knowing that you're going to forget it. They intentionally force you to do that because it's a waste of time. The things that would have been useful to you, learning how to start a business, be an entrepreneur, how to lower your taxes, okay, how to purchase a house, how to handle loans, how to pick a spouse so your marriage is likely to work. They don't teach you any of that kind of stuff. Almost nothing. They should be teaching, the ancient Greeks, the ancient Romans, the Renaissance, and all that stuff. So you have a historical perspective you can use to compare current events. None of that. They got rid of all that stuff. So anyways, I won't go any further into that. But the bottom line is I don't think the school system is designed to educate you. I think it's designed to turn you into a minimum wage chump and a factory worker, an obedient conformist person rather than a thinker.
Okay. Well, Randy was asking earlier, what is the max acceptable number on the EMF meter that you were talking about?
You know what? I don't know the exact units and numbers anymore. It's been a long time ago. I was all into it when I first bought my house and I was, setting up the kids' bedrooms and stuff. So I wanted everything to be good. And nowadays I just turn it on, and I've got one in the other room, but I don't pay attention to the units. I just see if I can get it as close to 0 as possible. And I've been able to do that in like my office area and in my sleeping area. So that's what I do. But you can buy them, you can buy them like the one I have. It checks EMF and it checks a few other things too. And I check it in each one of them. And I've been pretty happy with the numbers I've gotten. It's worth doing. Like, what did I learn from it? Okay. I learned that, for example, you don't want a microwave in your house. The best thing to do is throw your microwave in the garbage can. Donate it to Goodwill would be my advice. That thing generates a lot of EMF, even when it's not on. When it's on, it's off the charts. You want to leave the room, get far away from it. I also tested all the different driving routes that I would go to my work. And I found that some driving beneath some high power lines generated far more EMF. So what effect did that have on me? I won't stop my car at a stoplight underneath one of those. I'll avoid a stoplight that tries to force you to sit underneath one of those electrical power lines, the big high power lines. I won't do it because sometimes on a bridge, they're pretty low. And so I won't drive past one of those because I worry if you're sitting there in a traffic jam and you're stuck sitting under one of those things 5-10 minutes, probably not good for your brain.
Okay. Jim wanted to know, how long should it take to fall asleep?
It should happen pretty fast. By the time you hit the pillow, you should go to sleep pretty fast. I don't have an exact time for you, but it should be almost like rapid. You don't even think about it. You just lay down. So if you exercise in a day, you'll have more sleep drive, it's called. Avoid taking naps. You'll have more sleep drive. Don't drink any caffeine. Avoid stressful things at night. All of that will help you to decrease your sleep latency, the time it takes before you go to sleep. And I've heard other things too, but I've never tried them. Like supposedly there's some trick. You breathe through your nose, hold your breath, and do that a couple times, and supposedly it helps you. Now, that might be complete BS. I'm just letting you know I've sort of come across these things. For me personally, I don't have any problem with it. I don't ever drink caffeine or alcohol, none, zero. And I exercise a lot in the day to the extent that I can. I always do little things like take the stairs, stand up when I'm on the phone, and walk around whenever I get a free moment. So I usually just hit the pillow, boop, sleep. So for what that's worth.
Yeah, I can definitely relate to the exercise because for me, I exercise every day, and I have the same experience. I usually fall asleep, almost immediately. Some people, it could take them maybe 10 or 20 minutes, and I think that some people don't give themselves enough time, that perhaps they should just, stay there for a little while longer before it happens. But yeah, definitely, it's like, when I go to sleep at night, it just feels like a relief. Like, now I'm ready to sleep, and I don't have to stay up late to get that feeling. I really attribute it a lot to lack of caffeine, absolutely, but the exercise. I definitely feel that has been very helpful to me. Okay. Karen said, I feel like my sleep is lighter than it used to be, and I wake up at the slightest noise. Is there a way to get deeper sleep? Yeah. Yeah,
that's part of getting older. It's just the older we get, the less deep we tend to sleep, the less time we tend to spend in slow wave sleep, the deepest form of it. So I would do everything I can. Basically, I kind of look at life and health as like Super Mario Brothers, a video game. You do the good stuff, you get energy points, you get good points for health. You do the bad stuff, and it gets subtracted from you. So I would avoid all the stimulants. So like all the processed food, all the MSG, MFG, and the mitochondrial inhibitors. Get your brain cells working optimally. Avoid all the caffeine. Avoid all the cigarettes. Avoid all that stuff that's bad. Check the EMF in your bedroom. Get all the electronic stuff out of your bedroom except for your alarm clock. So basically, I'd go through it. I'd go through these lists of sleep hygiene habits, and I would do all of them. And I'd try to get some exercise in the middle of the day. And try to get some sunshine in the middle of the day if you can. Try to get some exercise during the day. And you can do lots of little things because all of us, usually have to work or have some other things that we just have to do. So, for example, like I work in a hospital, and I have to go up very often to a high floor. And 99% of hospital workers, they take the elevator. I never, ever take the elevator. I would be mad at myself if I took the elevator. I go up the stairs as fast as I can without hurting my leg. I would run, but I get Achilles tendonitis if I run. So I can just walk fast, okay? And I always do that. And I always make myself do that. And I tell you that because sometimes in a day I'll go 50 flights of stairs. When I'm at home, I always force myself to use the stairs as much as possible in the daytime. I'm always pushing myself because I know in the long run, that's all it takes. You don't have to go to a health club. You don't have to spend money on a gym membership, drive over there and deal with all that. Just push yourself whenever you get a chance. Park your car far and walk more. When I come home from work, I'm going to take a quick shower. A couple times a week, I'll lift weights real fast. Crank out a couple push-ups. I'll do some curls for the girls and some isometrics and a few other things. So I'm always going to push myself to maintain high standards. So I take a piece of paper and I say to myself, what do I need to do to maintain my physical fitness, my physical strength? Is my weight where it should be? I check my labs periodically. They're all good. I don't check them very often, but I know they're all good. And so what I do is you sort of maintain yourself as best you can. If you're hearing a lot of noise, do you need to do something to sound restrict your bedroom? For example, at my house, the family was kind of noisy, and they would all go to bed later than me. So I would put the furnace on, and it would heat up the room, which I liked. So I'd sweat a little bit. I'd be less likely to wake up and have the void from the prostate. And the noise would distract me from the family making noise. I made the bedroom as dark as possible, other than just enough to see to my way to the bathroom and not fall. I think EMF protection improves sleep. I believe that it does. Some people think grounding helps too. Grounding is when you put a little mat on the ground and you put it into the ground thing on your electrical outlet. And then you put your bare feet on it, like when you're sitting at your computer at night or reading a book or whatever. Some people think that helps. I think it helps just because I noticed I slept better after I did that. I was already sleeping pretty good, but I slept even better after I did that. Some people say grounding mats don't always work. I don't know if they always work or not. I've seen the papers. I've read the books on them and all that stuff, but you can try it and see if it works. They don't cost too much. I think they cost about $40. So that's a couple thoughts. I can't hear you. I can't hear you anymore. I can't hear you anymore.
Okay, how's that? Are we back?
Now I can hear you.
Okay. I really want to thank you so much, Dr. Rogers, for all that you presented with us today. And it's been just so informative and so helpful. And I wanted to encourage the Green Warriors to click like if you enjoyed what Dr. Rogers has presented today. And Dr. Rogers, can you please tell us about what you do and how we can find you?
Oh, okay. Yeah, my name is Pete Rogers. I'm a clinical conventional medicine physician. That's how I make my money. But what I really enjoy is all this nutrition health stuff. I have a YouTube channel called Peter Rogers MD where I post a lot of videos. I've written a whole bunch of books. Probably the books most relevant to this audience would be, here, I'll even show you one of them, Food, Mood, and IQ. This is the best book ever written about the brain by far, 10 times better than anything else written. I'm the best expert in the world on how to prevent dementia. Also, I have the best theory of what causes back pain, this, spinal ischemic theory. And anyways, yeah, so either from reading my books, my other book that a lot of people would find helpful would probably be the Medical Reformation book, where I go through how you minimize your risk of obesity, diabetes, hypertension. So those are a couple of them. I've written a whole bunch more. I've written like 20-something books, a lot of stuff on study skills, et cetera, and then some things in the humanities topics. So anyways, I hope you find them helpful. I can't hear you again.
Sorry about our audio. Sometimes I guess we had a little clicked there. So thank you so much for sharing, Dr. Rogers, your knowledge on sleep and helping us understand its vital role in overall health. And what is your final take-home message for our Green Warriors today?
Well, if you're not sleeping as well as you think you should, I would systematically go through this video and try to improve everything, because it's an important part of health. If you're missing out on sleep and you're sleep deprived, then you're going to be insulin resistant and you're going to be a little bit immunosuppressed. You don't want that.
Yeah, that's fantastic. So I wanted to encourage everybody to please click like. I know I asked you that, but it's always nice to see that you appreciate what's going on here today. Green Warriors, what is your takeaway today? Tell us what you learned from this presentation. Did you have an aha moment? I liked when Dr. Rogers recommended laying on your right side and as the best position to sleep. So that's my preferred position. So works out good for me anyway. And I also wanted to thank Jess Tatt's Voice. She did the promos and she did the voiceovers, the countdowns. She really helps get the message out about this channel. And I would like to thank her for all of her work. And I wanted to ask her who is coming up next.
Do you know what's silently damaging millions of livers every year? Have you or someone you love been diagnosed with fatty liver disease? Join us as Dr. Jeffrey Pierce reveals the shocking truth about NAFLD and how to heal your liver naturally. Join us on Wednesday, March 5th, 3 p.m. Eastern, noon Pacific on Be Green with Amy Live.
Wow, that's something that you were just talking about in your presentation. So that's going to be interesting. I really want to thank you, Green Warrior, for joining us today. Your engagement and your support really make these discussions meaningful and impactful. And I really hope you're feeling inspired to take a closer look at your food choices and other lifestyle choices to make some positive changes for your health and well-being and getting better sleep. Because remember, every bite we take and the lifestyle choices that we make is an opportunity to nourish our bodies and, like Dr. Rogers, become the healthiest versions of ourselves. So please stay tuned for more empowering content, and please subscribe to my channel. Check out Dr. Rogers' YouTube channel as well, and share our message with others who you think can benefit, because together as Green Warriors, we can make a meaningful difference in the world. And I really would like to invite you to go to my website, begreenwithamy.com/join, and I would be happy to send you 5 free recipes and give you lots of things to enjoy and good food it's also hopefully plant-based, and it is SOS free, no sugar, oil, or salt added, and I'll send them right over to you. So Green Warriors, I would like to encourage you to join me and Dr. Rogers with my tagline. You can type it in the comments and join us with that. Are you ready, Dr. Rogers?
You want me to start it out?
Oh, no, I just wanted to make sure you're ready.
Yeah, I'm ready. I know the routine.
The drill. Until I see you all again, remember, be strong, be well, and be
green.
Thank you so much, Dr. Rogers. Thank you, Green Warriors. Please join us again really soon. We look forward to seeing you again.
Looking for really tasty recipes that are SOS free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong, be well, and be green.